Asthma, COPD and asthma-COPD overlap syndrome, ACOS, are signified by the constriction of airways, making breathing difficult and strenuous. Labored breathing in asthma and COPD happens due to constriction of bronchioles and the inflammation within the walls, making the airways narrow. With the tensile strength of the smooth muscles getting weakened, gas exchange within the alveoli gets compromised, exacerbating the condition of the patient. Slickhaler, with its unique action, bolstered by its aerodynamically optimized design concepts, aids the contents of the dry powder capsules to penetrate into the deep recesses within the respiratory pathway, targeting the intended sites of action. The vertical rotation of the capsule within the capsule chamber facilitates minimum resistance for the free flow of the contents in a linear motion, targeting the deposition of drugs, covering the lungs at various inspiratory flow rates. The device is designed in such a way to aid the deposition of much-needed medication, even at a much reduced inspiratory flow, thereby accentuating its use in patients suffering from asthma, COPD and asthma-COPD overlap syndrome, ACOS. The inhaled bronchodilator and the corticosteroid facilitate the reduction of inflammation and opens up the bronchioles for optimum intake of air, diminishing breathlessness and aiding the ease of breathing.